are you?
Hi, how are you?
Good. My name's Lauren. I'll be your nurse today.
Oh, good.
Can I get you to state your name and date of birth for me?
Yes. Porter Fogarty. Birthday is July 4th, 1960.
Okay. Do you know where we are?
We are in St. Mary's Hospital.
Okay. And what year is it?
2020.
All right. Patient is alert and oriented times 3. Have you experienced any difficulty breathing?
No.
Any chest pains?
No.
You notice any changes of temperature in your hands or feet?
No.
Got any swelling in your hands and feet?
No.
Okay. Have you noticed a persistent cough?
No.
All right. And have you noticed any faintness or lightheadedness?
No.
Okay. So the patient is sitting upright. He responds appropriately to conversation. His feet are on the floor. His skin is appropriate for the ethnicity. He doesn't have any facial grimaces. He is dressed appropriately for the weather. He seems like he gives up on his hygiene. His thorax is symmetrical. It has a ratio of 1 to 2, just side to front and back. I'm going to go ahead and have you lean back a little bit and then tilt your head that way. Alright, and this way. Okay. So no jugular venous distension, which is good. He does have a visible carotid pulse, which is normal. Feel your trachea. Trachea is midline and symmetrical. It is movable, which is good. You feel your carotid. Okay, he has a good carotid pulse. Right. He has good skin turgor. It is warm and dry. Good brachial. Good capillary refill bilaterally, less than 2 seconds. And now his femoral artery is there, and his popliteal artery is here. Not gonna do this. I'm not noticing any edema in his arms or legs. His legs feel dry and warm. Strong pulse. So all of his pulses are strong. They're not bounding, so they're like a normal 2 rating, which is good. I'm going to go ahead and listen to your carotid artery. I'm going to have you hold your breath. All right, you can breathe. Listen to your heart. S1, S2 sounds are present, S3 and S4 sounds are not present, which is good. I'm gonna have you inhale and exhale. I think it's okay.
I don't know.
I think it's okay.
Okay.
The screen went dark, but I don't know if it recorded what I just did, but I said that he has S1, S2 sounds present, no S3, S4 sounds. Just in case.
Mm-hmm.
I'll have you breathe in. Again. Your tummy grumbled.
Good dinner.
Side. I'm gonna have you face that way just so she can see your back. Breathe in. Good. Alright, so all breath sounds seem clear and equal. I don't hear any inventicular breath sounds. Sorry. Alright, I'm going to have you exhale and then inhale. Alright, and I don't know if I checked capillary refill on your toes. I'm just going to do that real quick. Okay, so these good capillary refills bilaterally on both feet, less than 2 seconds. Okay. Hopefully that was good. Alright. I'm going to go ahead and do the data analysis. So he has a respiratory rate of 30 breaths per minute, which is high. He has an O2 sat of 95, which is normal. High temperature, good heart rate, high blood pressure. His white blood cell count is elevated. Red blood cells, normal. Platelets, normal. Glucose is normal if he's fasting. If he's not fasting, it would be low. His TSH is high. I think a chest x-ray would be appropriate just to see if there's any fluid in his lungs that's causing his labored, diminished lung sounds. I think sputum cytology would be appropriate. It's usually appropriate if cancer is indicated. I don't know if diminished breath sounds would be a sign of cancer. I do think a culture should be performed because he does have green sputum, phlegm, and it does seem that he has an infection since his white blood cell count is elevated. I think a lung VQ scan is appropriate. It does check blood perfusion, so if he does have a pulmonary embolus, that could cause his shortness of breath or the diminished breath sounds, so that would be a good idea. Okay, thank you. Bye.